I do think that there are two cohorts of patients that can benefit from the neuroplastic surgery approach. So the first are the complicated patients who've had their neurosurgical procedure somewhere else, outside of Hopkins. And sometimes they have radiation and they have a wound breakdown issue or a wound infection, or they had their decompressive hemicraniectomy, somewhere else, and they need to be reconstructed. So, somebody who's basically had their definitive procedure somewhere else and has had a problem. So we can help with those patients because our armamentarium is greater. So we can use local tissue flaps, we can do scalp rotations, we have a variety of techniques to harvest autologous tissue to help with these very challenging soft tissue defects and scalp wounds. And our approach is about achieving symmetry, and we really have different tools to do that. So that's one cohort of patients that I think really benefits, and that was the focus of our work in the beginning when we first started this. Okay, it really was this challenging group of patients, and taking care of those patients opened our eyes to all the different problems that exist and gave us experience so that we learned from our approach and we learned about the pitfalls. So taking those experiences and being able to apply that to the second cohort of patients is really beneficial. So the second cohort of patients in my mind are the ones who've only just found out they need a craniotomy for something, whether it's a craniotomy for meningioma, because there's dural involvement and the skull is involved, or whether it's some like a vascular problem where they need a craniotomy that can result in temporal hollowing, which is very deforming to them because it looks like an indentation on the side of the head, and it can be disfiguring. When somebody learns that they need to have some kind of procedure like that and they come to us, we think about that. So it's not that we are focused definitely on achieving the best neurologic outcome that we can, but we also think about how can we achieve the best aesthetic outcome that we can from a neuroplastic surgery view. So that means that even though, yes, the critical portion that in my mind is, of course, the intracranial work and making sure they don't have a stroke, making sure that they are, as perfect neurologically as they can be, but to also emphasize that it's just as important to them in terms of the patient outcome. It's just as important to them that they wake up from surgery and look the same as they did before surgery. And, I would say for some patients, that's even more important. One more thing is that we have now taken this to the point where instead of fixing a problem after it's developed, we preemptively avoid the problem. So that there are people actually who are undergoing single stage operations that previously would have needed two separate operations to take care of a problem. So that there are actually, we have identified people who actually we can spare an extra operation in.